Good morning, everybody. Thank you for joining us from wherever you're joining us. I would just remind us first that Dalhousie is located in Mi'mahi, which is the ancestral territory of the Mi'ma people, and we're governed here by treaty relationships with those people. I want to welcome you very much to our presentation this morning on a very topical, contemporary topic of COVID and its effect on the EU border regime. I want to draw your attention to how this platform works. We'll have a 30 to 40 minute presentation from our speaker, and you may type questions in the box which has a little question mark, the little tab at the top which has a little question mark, and then we will be accumulating those questions, and after the presentation we will be having a question and answer session, and he'll be responding to some of those questions. So I do want to draw our attention first to our speaker, Ngo Chun Luk, who's a researcher in the Justice and Home Affairs Unit at the Center for European Policy Studies, or CEPS, where his research is focused on European citizenship, migration, asylum, and fundamental rights. He obtained a PhD in law at Maastricht University with a focus on diaspora, citizenship rights, and quasi-citizenship. Before he joined CEPS, he was involved in the development of the Massimide Global Expatriate Dual Citizenship Dataset and the Involuntary Loss of European Citizenship Project. So he's going to speak to us today on internal borders and the health crisis in the EU and the impact of COVID on the Schengen regime. So without further ado, I will turn it over to our speaker, and thank him very much for joining us today.
All right. Thank you very much. Can everyone hear me? Yes. All right. Thank you very much. So as introduced, my name is Chun. I'm a researcher at CEPS, and today I will be speaking to you about the topic of internal borders, the EU, the Schengen, and how the EU and the member states have responded to the COVID pandemic. And can we pull the PowerPoint presentations up, please? Thank you. I assume it's up. So if, as you can see from the title of my presentation, the question posed today is whether COVID is a threat to Schengen. Now, my presentation will be structured more or less along the following lines. I'll be briefly setting out a few key principles that underlie the EU free movement, the concept of EU free movement and the Schengen area, which is actually, I believe, crucial to understand the EU context, the context of Schengen, and how this differs, for example, from measures that have been taken, for example, in Canada or the United States, Australia, Singapore, South Korea, etc. Now, then I will briefly set out the EU, how the EU and the member states have responded to the COVID-19 pandemic. And I would like to point out here that my presentation today is mostly based on two papers that we've written, one at CEPS itself, titled Love Thy Neighbor, if I'm not mistaken, and the other one that I co-wrote as well with Professor Carrera for the European Parliament, titled In the Name of COVID. And why am I stressing this? It's because the second of these, which is more or less, you could say, the latest of our papers, was published, if I'm not mistaken, towards October last year, and only covers the situation up to around end of August last year. And as I guess everyone will be well aware, COVID is a rapidly changing thing, and member states' responses, countries' responses are constantly evolving. So it would be quite a challenge to cover everything up to date. So my presentation will primarily be focused on the situation as it was towards the end of August. That does not discount, let's say, that what we set out also applies, and we believe it continues to apply to the EU and its member states and how they continue to respond to the COVID-19 pandemic. But let's say, as a point of order, my presentation is limited, in fact, to the end of August. Now, after that, I will briefly set out key questions of legality and proportionality of what the member states have, the measures that member states have adopted throughout this pandemic. And finally, I will come to a few concluding remarks and try to answer the question of my title slide. Now, as I briefly mentioned in the introduction, what you could say sets the EU apart from other countries more generally, sets the EU apart from other countries more generally is the existence, I would say, of these principles, this concept of EU free movement and the concept of the Schengen area. Now, very briefly on the EU free movement. The principle of free movement of persons within the EU is, you could more or less say, is one of the key pillars, one of the key foundations of the EU itself, together with a number of other free movement rights. Now, what does this EU free movement of persons entail? More or less, you could say it entails that EU citizens may enter, they may move to, reside in, and freely leave any other EU member state. Now, while restrictions to this free movement is possible, these restrictions must be examined on a case-by-case basis, and they must be proportionate to the aim that is being sought. And importantly, again, this is a key principle that you will see repeated across my presentation, is the concept of the principle of non-discrimination, and particularly non-discrimination on the basis of nationality when it comes to EU free movement rights. Now, for the Schengen area, I'll try to simplify this as well because it can get quite technical, but more or less what you could say, the Schengen area is an agreement between, to date, 22 EU member states and 4 so-called Schengen associated countries to come together towards one bloc, meaning an area, the so-called Schengen area, within which there's an absence of internal border controls, or you could even say absence of internal borders, combined with the principle of a common approach towards external border management and external border controls. Again, here, the principle of non-discrimination is key. Now, this abolition of internal borders within the Schengen area, the creators of the Schengen area, the Schengen acquis, you could say, foresaw that there might be potentially situations, crises, which may necessitate member states, which may require member states to briefly introduce a limited form of internal border controls again, meaning controls between other Schengen countries. Now, what is important to mention here is that the Schengen Borders Code, which governs the, let's say, which contains all the rules surrounding the Schengen area and how member states have to deal with the external border management and the issue of the absence of internal border controls. The Schengen Borders Code clearly sets limits to when, how, and for how long, for example, member states could opt for using such a tool, such as temporarily reintroducing internal border controls. Now, according to the Schengen Borders Code, this temporary reintroduction of internal border controls, quite a mouthful, can only be based on a threat to public order or public safety, if I'm not mistaken. If anyone wants to correct me, that's perfectly fine. I remember there was public order and public safety. Member states must notify the Commission and other member states that they intend to temporarily introduce these border controls. And they must justify reintroducing such internal border controls. And again, as I stated before, the Schengen Borders Code sets out, or let's say contains limits to when and for how long member states or Schengen countries are allowed to reintroduce such border control, internal border controls. Now, moving on to specifically the COVID pandemic and how the EU and the member states have dealt with the issue of cross-border mobility, so mobility across borders. Now, initially, we can see from the EU's response, we can highlight, let's say, two key areas. The first is that the European Commission, let's say throughout March and early April, issued a number of guidelines to member states on how they should, or let's say recommendations and key principles, etc., on how they should take measures towards addressing the COVID pandemic in line with EU law and principles. Now, for the topic of today, the important document to mention here is the guidelines issued by the Commission on around 16th of March on border management. And some of the key recommendations, key issues, key principles that the Commission sets in this document are that there should be a preference for health-related measures, health screenings, isolation, quarantine, ensuring access to healthcare, etc. There are others, but such as, let's say, ensuring transport of goods, but I will leave that part out. At the external borders, the Commission does say that third country nationals, and for those that are unfamiliar with this concept, the concept of third country nationals in EU law means citizens, nationals of countries outside of the EU, and let's say in the case of Schengen, also outside of Schengen. Now, at the external borders, the guidelines state that such third country nationals may be refused entry if they form a threat to public health. At the internal borders, however, meaning within the Schengen area, the Commission sets out a few recommendation advices, which include the following: that health checks, meaning temperature checks, etc., within the Schengen area do not require reintroduction of internal border controls. And by this we mean, let's say, controls, checks at the border in the context of crossing the border itself, meaning, for example, passport checks, visa checks, etc. So the Commission clearly states that health checks do not require reintroducing internal border controls. The Commission also strongly prefers health-related measures, including ensuring access to healthcare for persons who are entering who are maybe at risk or who are positive for the COVID-19 infection, so a preference for health-related measures over refusing entry at the border. And again, I repeat, the principle of non-discrimination, the Commission also reiterates, is an essential principle here, particularly that member states, so Schengen countries, member states, should not apply any measures to other citizens, particularly EU citizens, that they would not apply to their own nationals. Now, the second initial response of the EU, you could say, towards the COVID pandemic has been the so-called EU travel ban. And I remember at the beginning, towards March, when this was announced, there was this whole issue with between the EU and the US, but we'll leave that aside. The EU at the time recommended the closure of the EU external borders. Now, why do I say recommended? It's because the implementation and the management of the EU external borders is still primarily in the hands of the member states themselves. So the EU recommended member states to close off its borders for entry from third countries. Now, importantly, this EU travel ban also clearly states that EU citizens and residents of EU member states must be allowed to return home. Moreover, this so-called travel ban also lists a number of key categories of persons who are traveling for essential reasons, and some of these include, if I'm not mistaken, diplomats, workers in charge of transporting goods, etc. These persons must be permitted to enter the EU, so they would not be subject to this EU travel ban. Now, in our study, we found that EU member states have generally followed this EU travel ban. Now, with some slight deviations, which I will come back to at a later part of the presentation. Now, in light of these two, let's say, EU responses, how have the member states themselves responded to COVID? Now, what we've seen, particularly in the early period of the COVID pandemic in Europe, is that member states have responded with containment measures, particularly entry bans, that were taken in a unilateral manner, ad hoc, and in an uncoordinated manner. There have been a whole scala of temporary reintroduction of internal border controls. Some member states have even moved towards closing borders and denying entry. And particularly in early March, you saw that some of these entry bans have particularly targeted the so-called, or the member states that have so-called been, or who were the first ones who truly suffered a crisis, or a COVID crisis, you could say, particularly, for example, Italy and Spain. Now, this graphic shows, which is a graphic published in our paper and is, again, the situation as it was towards the end of August, shows the member states who have introduced internal border controls and who have then subsequently, as of August 2020, lifted such internal border controls, the ones who still have them in place, the ones who have not introduced them, and also the ones who have introduced national measures such as entry bans or travel bans, but that have not notified the Commission under the Schengen Borders Code that they introduced, let's say, such entry restrictions, which, logically speaking, if you're going to restrict entry, you must also be able to control who enters or exits, meaning internal border controls. Now, I would just like to briefly draw attention to one important thing, which is the small amount of countries in green who we found have not introduced any form of internal border controls throughout the period of March to August 2020, which were Sweden, Latvia, the Netherlands, Luxembourg, Liechtenstein, and Greece. So that means you could say all member states have, in this idea of a crisis mode, responded with closing borders, closing borders. Now, what we've seen later is that most member states have slowly transitioned away from entry bans themselves towards other forms of entry restrictions. Now, these restrictions include, for example, requiring travelers entering from abroad, or in most cases from countries that have been identified as having an increased risk of infection or affected by COVID-19, let's say travelers coming from such countries, to have within their possession a medical certificate demonstrating that they have tested negative for COVID-19 within, let's say, at the latest 72 hours prior to their arrival. Other restrictions include, for example, the obligation to fill in a passenger locator form, which includes contact information and mostly travel history of such persons arriving over the past 14 days. some countries have also introduced mandatory quarantine. Most, let's say, initially at the time for a period of 14 days, and later with more knowledge, more scientific knowledge about how how COVID-19 works. Some member states have shortened that to a period of 10 days. Now, with all of these measures, what we've also seen is that, again, there's been a lack of coordination among member states' responses herein, which leads to, you could say, even a patchwork of travel restrictions which apply to intra-EU plus travel. And by EU plus, we mean in the paper, let's say, the EU member states plus the Schengen associated countries. So there's been this lack of coordination, and this graphic, which is also in from our paper, shows the differences, the wide differences in approach that have been taken by member states. Some member states have introduced entry bans, some require prior proof of negative COVID-19 testing, some prefer mandatory quarantine, some have moved to in-country testing, etc. And this lack of coordination, again, and I will come back to this at a later slide, sort of sits at odds with the key principles that I set out at the beginning of EU free movement and of the Schengen area. Now, I'm just going to conclude this section with drawing attention to two more recent EU responses to the COVID-19 pandemic. The first one is the EU gradually reopening its borders, the EU external borders, to non-essential travel. This has started, let's say, around end of June 2020, and has been constantly updated based on the information, which I will get to that quickly. Now, what this gradual reopening entails is that there is sort of a bi-weekly updated list. I mean, I'm not really 100% sure how bi-weekly it has been recently, but I guess that, let's say, every 2 weeks they assess again whether the list needs to be changed. And this list means a list of third countries for which the EU opens its external borders for non-essential travel. And particularly here, you could think about tourism. Now, this EU response also includes a strong urging of member states not to deviate from this list by including additional countries. The Council recommendation, let's say, which is the legal instrument which sets out this relaxation, also says that member states are allowed to open the external borders for fewer countries, but they should not do it for more countries. There should also, again, be a continued access to travelers who are entering for essential reasons. And what we've seen is that member states have generally followed this line. I just briefly, anyways, I will move on to the presentation, but if someone from the technical side could, in the chat, give me a time check, that would be appreciated. In the meantime, the second response, you could say, to the COVID-19 pandemic is a coordinated approach by, or let's say the attempt by the EU, and particularly the European Commission herein, to move towards coordinating the actions and measures of EU member states and Schengen countries towards measures affecting the internal borders. Now, some of the key concepts, principles, issues underlying this coordinated approach is that there would be a color coding of the EU and the Schengen area and its regions particularly based on objective epidemiological evidence, and that this color coding would be done by the European Center for Disease Control, Disease Prevention and Control, if I'm not mistaken, the ECDC. Now, this coordinated approach also states that member states can make entry from an orange or red zone within the EU's internal area, the EU or Schengen area, conditional upon a period of mandatory quarantine and or testing. Again, at least and particularly in the proposal initially submitted by the Commission, you see that there has been an emphasis again on the principle of non-discrimination, of not discriminating between own nationals and other EU citizens. And importantly, member states have been strongly discouraged from reintroducing entry bans. Now, I haven't put it in the slide, and particularly because it's more of a preliminary assessment based on, let's say, the knowledge that I have of the issue at the moment, but member states have not fully followed this attempt, which, if you look at it, let's say from an EU legal perspective, has been agreed upon by all the member states because it was a recommendation adopted in the Council. Member states have not fully followed this line of coordinating their approach towards the pandemic. Now, I'm just going to briefly go through what the issues of legality and proportionality of the member states' responses that we set out in our paper. Now, most member states we found have made an instrumental use of the temporary internal border controls that were permitted in the Schengen Borders Code, and they've gone beyond what the Schengen Border Code sets out. Now, particularly, this is going to move to a different graphic, but I'm going to mention first, we're talking about the legal basis. Now, if you look at this graph, in orange is more or less when member states have first introduced internal border controls in response to the COVID pandemic. In blue is when member states have enlarged the scope of their internal border controls, because the internal border controls can be limited to specific member states or Schengen countries, or it could be broader. In gold, dark yellow gold, is when member states have abolished internal border controls that they have temporarily introduced to certain countries. And in green is when they've completely abolished their internal border controls and returned back to the principle of the Schengen area. Now, it's not very clear from the graph, but I can mention that according to the Schengen Borders Code, and again, I think I've mentioned this before already, the possibility for member states to reintroduce internal border controls is limited in time. If I'm not mistaken, but I can come back to that during the Q&A, it's limited to about maximum, you could say, 2 months, with the presumption that member states will or should either have fixed the issue or come to alternative arrangements to tackle the crisis. But as you can see, most member states have introduced these internal border controls around March, towards end of March, mid-March, April, but only finally gone back to absence of internal border controls towards June, July. That's way beyond what the Schengen Borders Code prescribes. Moreover, what we've seen is that once one period has expired, member states have just simply switched to another legal basis within the same Schengen Borders Code to prolong their internal border controls. Moreover, we've seen that member states have what we call an expansionist use of the notions of public policy and public security, which are the grounds on which the Schengen Borders Code allows them to make an exception. And what we mean particularly here is that member states have expanded the concept of public policy to include public health, the public health crisis in all of its forms. While one of the things that I set out at the beginning was in the guidelines set out by the Commission is that in exceptionally member states could use public policy, the public policy exception, when it comes to a health crisis. Here, particularly, what we've seen is that there has been a lack of EU enforcement and evaluation of adherence to the Schengen Borders Code. And again, this is in the past, because what we've seen recently, and I don't know if the audience has followed the news, European news a bit, but the Commission has sort of, you could say, how do you say it? The Commission has asked questions of Belgium, for example, who since January have introduced a blanket entry ban again. And the Commission has come to Belgium and said, look, you have to, this is not in line with the rules. But back then, when we finalized our study, there's been more or less silence from the side of the European Commission. I'm going to briefly go through the rest of this. Again, there have been questions of legality of the member states, of the entry bans and restrictions that the member states have imposed, particularly the question of non-discrimination, particularly when it comes to, this has been the case, for example, when it comes to introducing measures that apply differently for their own nationals than for other citizens. An example that I can give, for example, is entry restrictions that have been imposed by Hungary at a point where their own nationals were allowed to enter, and if they came from an area at risk of COVID, they would be subject to a mandatory quarantine, while other persons, let's say non-nationals and people who do not reside in Hungary, and this includes EU citizens. EU citizens were also who, let's say, tried to enter Hungary from a country that is at risk would be denied entry. Now, what we've also seen, and the examples that I can mention off the top of my head now is Germany and Denmark, is that there's been a large discretion given to the enforcement authorities, and here I mean the border management authorities, to decide whether travelers comply with these health-related entry restrictions. The German case, for example, is that at a certain point, travelers from certain high-risk areas, and I believe this is still the case for third countries, are not permitted to enter Germany unless for an essential reason. And particularly the case when Germany initially introduced this concept or this restriction, it was left completely up to the authorities to decide on a case-by-case basis whether someone was entering for essential reason or not. There were no legal provisions that we found or any list, even on the official website of the German government, that stipulated what would be considered an essential reason. And again, when it comes to legality, we have to stress this issue of an incremental burden of proof, something that may have been legal, and this burden of proof will also come back to the question of proportionality, something that may have been legal and proportionate at the beginning of the pandemic, particularly when it was not very clear how this virus spread, what the impacts were, etc. The burden of proof increases as time passes and we learn more, and more techniques are available to deal with the pandemic other than entry bans, for example. Now, when it comes to the proportionality of the member states' responses, the first question we can ask is the effectiveness of the restrictions that have been imposed. Now, this has been particularly the case when it comes to entry bans. We really have to question whether an entry ban, and particularly an entry ban only to a specific country, as it was the case at the beginning, only an entry ban to persons arriving from Italy, for example, within the Schengen area, is effective at, and we presume the aim is to prevent the virus from coming into the country. Moreover, is the continued application of entry bans effective once the virus is already inside of your country? Moreover, when it comes to proportionality, we have to assess whether the degree to which these measures seriously interfere with fundamental rights of resident citizens in the EU. And here we're talking about the free movement rights, but also the concept of privacy and data protection. Whether, let's say, the measures that have been taken are proportionate to the interferences that have been caused. What we've also found is that the measures that some member states have adopted disproportionately affect certain groups of persons. A particular example that I can give is the entry, for example, from outside or even inside the EU, but particularly from outside of the EU, outside of Schengen, of asylum seekers. Asylum seekers under international law have a right to seek asylum, while some member states have excluded, or you could say not included, asylum seekers as persons who are traveling for essential reasons. And our paper also addresses this concept of data valence. You could understand this as, let's say, the increasing surveillance of and the use of personal data in surveillance of persons, and how this rhymes with the issues of purpose limitation, data protection, and privacy within the EU, but I will not address this topic at this point. I'm finally going to come to my concluding remarks. In our paper, we issued more or less 3 key recommendations, which were primarily addressed towards EU policymakers. The first was that there needs to be an effective and timely enforcement of existing Schengen and EU law standards. And let's say, as one of the co-authors, I am at least pleased to see that the Commission is taking steps towards ensuring that the Schengen as an area without internal border controls is upheld as much as possible. Moreover, we recommended that the EU rights and freedoms, which are so dear to the EU, must be upheld and enhanced, even within this COVID-19 pandemic. And here, particularly, we're talking about the free movement rights of EU citizens, but also the concept of privacy. And finally, we made recommendations relating to the evaluation of and accountability for the COVID-19 measures which have been adopted. Now, coming back to the question that was posed in the title of my presentation, is Schengen under threat from COVID? Now, our answer as authors of the paper is no. Can you say that a system is under threat from a crisis if the parties to that system, the countries, do not follow the rules of that system? Then it's not the issue of whether the Schengen, the system, is under threat, but more whether member states and the EU as the guarantor of the proper application of the Schengen area are properly applying Schengen. And we've not seen evidence so far that even with the proper application of Schengen, that this crisis cannot be dealt with. Particularly, and I've mentioned this before already, that member states have been incremental using the provisions in the Schengen Borders Code in an expansionist way, while particularly at the time, there has been a lack of any kind of response, monitoring, or enforcement from the side of the EU. So our answer as authors of the study is no, Schengen is not under threat from COVID. That has been my presentation. Thank you very much. And I give the floor back to the moderator. Bob, thank you.
Thank you very much. It was a very thorough and informative presentation, and you managed to make a lot of very complex rules and regulations quite accessible to those of us who are not quite as well versed in the legal situation in the EU, and drew out some of the key issues related to the contemporary context. So we do have some time for some questions, and I'm going to start off with a question, because the number of the examples you gave do tend to suggest some degree of ulterior political motive, because as we know in the migration crisis of recent years, some countries have challenged the border regime on other grounds, simply that they want to impede the mobility of individuals, particularly refugee claimants, etc. So I was just wanting to ask if the member states' choices on internal borders, as you've seen them, do they seem to have connection to populist anti-immigration political forces in these countries, or are most of them acting out of genuine public health criteria?
I think my response, which I guess I will have to, let's say, preface it by saying that this has not been a response that we've addressed, I believe, in the paper itself. So this is more of a personal opinion, that there have been some member states, and particularly I believe that a lot of scholarly work has drawn attention to Hungary in this case, and a number of other Eastern European member states that have made an instrumental use of the COVID pandemic to pursue certain agenda that, let's say, given the political constellation there, you could say lean more towards more populist anti-immigration measures. So I would say, let's say, if the question is, were there member states that may have adopted these measures with a more anti-immigration, anti-refugee sentiment in mind? I would say yes, there most likely will have been a few of these member states. Have there been member states who have acted genuinely out of concern for public health? I believe the answer there is also yes. And I think particularly good examples, and I haven't addressed this in the presentation, but we've seen that how member states have moved on to applying restrictive measures only to certain countries and regions which they considered at risk, and the criteria on how they determine whether that country is at risk. We've seen that some member states have moved on to more objective and epidemiological evidence-based criteria, and particularly they've given the duty to identify these countries at risk to their public health authorities. And let's say there, I would say there is a clearer link towards these mobility restrictions and public health.
So it's a mix that would have to be investigated a bit more substantially beyond what you've covered to this point. But one aspect that interests me as well is your implication that the EU may not necessarily be enforcing elements as effectively as they might, because that seems to be a perception as well, that in terms of some of the anti-immigrant mobilizations in some countries and human rights issues in some countries, that the EU has not been as assertive in insisting on the rule of law according to the basic agreements in those countries. Is that something you do notice as well in terms of the COVID restrictions?
I think in terms of the COVID restrictions, I would say that the lack of an EU response is more likely to be a position adopted by the Commission that there has been a genuine need, or that it was not the opportune moment to address member states on possible infringements of EU law, the Schengen Borders Code, etc. But let's say this is, again, aside from more general discussions about rule of law itself, particularly with the example that I mentioned of Hungary, that let's say where I'm not sure I have the right answer for the Commission's position there, but more generally, the lack of an EU response that we've noticed, at least in the period that we examined from March to August, may have been more prefaced on the position, as I said, by the Commission, that it was not the opportune moment during, like, in the middle of the crisis to sort of tell member states that they're not complying with the rules. But again, I've also mentioned this example towards the end of my presentation. We've seen recently that the Commission has moved on towards telling member states that their measures are not complying with the rules of the Schengen Borders Code. And this has been the case, for example, with Belgium.
Right. So the next question, oh, sorry. Oh, over to me, I guess, Madeline. Yeah. The next question is whether the experience of the EU with regard to these responses is applicable to other contexts. And I noticed your recommendations, for instance, about how countries should proceed. Is any of that relevant outside of Schengen to what other countries might consider?
Well, I would say that some of our recommendations are, let's say, of a more general nature that should apply within all democratic societies, such as the principles of legality and proportionality, for example, of measures that countries that intend to restrict travel should do this in, let's say, the most effective way that also does the least amount of that causes the least amount of interference with fundamental rights, that subsidiary in nature, that there has to be scrutiny from democratic institutions, that, let's say, actions taken by the government should be scrutinized, particularly in the parliament. So let's say some of our recommendations make sense can be drawn to other contexts and be applied there. Other recommendations, I would say, are less applicable. And here I'm thinking more about, it hasn't been in the recommendation, but it has been a point that I've emphasized throughout the presentation, that key for the Schengen area and for the EU is to tackle this crisis in a coordinated manner, to provide a coordinated response to this. And I would say this is more likely to be applicable to the EU in light of this bloc, this territorial bloc without internal borders within, and the Schengen area, which requires an external, let's say, a coordinated approach to its external border management. So let's say the issue of coordination, while it would be preferable, or let's say advised elsewhere in the world. Let's say, for example, if there's going to be a lot of US-Mexico or US-Canada traffic, that a response that is coordinated between the two governments might be encouraged, but the urging for coordination is, I would say, more EU-specific, for example.
Thank you. So next question. Could the European Commission have played a more proactive role in coordinating member states' border control policies? Is there something they could have done earlier on to coordinate this somewhat more effectively? And back over.
Yes. So I think my answer depends. Let's say, should the Commission have done more? My personal answer would have been yes, or at least the Commission should have attempted to do more. The question of could the Commission have done more is a more technical one. Due to the nature of the EU and the division of competences within the EU between the EU institutions, particularly the Commission on one hand, and the member states on the other hand. And what we've seen is that public health and public health measures have generally been member states' competences. And that's also why you've seen more generally throughout this pandemic, the Commission's action has been more raising awareness, issuing guidelines, issuing recommendations, etc., rather than actually taking action. This has been the case for the issue of public health, but also for border management, which you see if you look in the Schengen Borders Code. While there is the involvement of the EU's external border management agency, Frontex, a lot of the border management questions are also still in the hands of the EU member states themselves. So let's say the answer to could the Commission have played a more proactive role is that they were quite limited with what they were competent to do under EU law, but perhaps they could have made a bit more effort in trying to bring all the member states together and towards one direction. Thank you.
Thank you very much. Another question. The next question involves what are the long-term implications of normalization of the practice of reintroducing internal borders? Is this going to create some long-term lingering effects and difficulties for the European Union? And back over. Okay.
Now, I would say this definitely depends on how the Commission responds to any internal border controls that are reintroduced or that are retained for excessive periods. Let's say the worst case scenario you could say is that if the practice of constantly reintroducing internal border controls is fully normalized and member states are readily available to pull this card and the Commission does nothing about this, then yes, I would say then at that point, Schengen, I think the existence of Schengen might be under threat if the absence of internal border controls, one of the key principles of the Schengen area, is being undermined in that way. But I think that the Commission has an important role in ensuring that member states apply the rules properly and do not reach for internal border controls as easily and, let's say, as automatically as in that worst case scenario.
Thank you very much. I have a question from my colleague, Dr. Banerjee, who wants to know the degree to which these COVID-related interventions in the context of Schengen have explicitly interacted with the policies of the EU's common European asylum system. He's asking this because in Canadian context, restrictive border measures have selectively been introduced in the context of the asylum process, largely in relation to US-Canada asylum coordination in the context of COVID pandemic. Could you maybe say more about whether similar measures have been incorporated in the EU policy, asylum policy explicitly, or for instance, has there been much of an appeal to public order considerations in the context of providing access to international protection? And back over.
All right, thank you. Now, my response would be it depends on whether you look at it from the perspective of the EU, at the EU level, or at the member states level. From the side of the EU, my impression has been that, and you've seen that also with the so-called EU travel ban itself, that the Commission has consistently underlined and pushed for the fact that asylum seekers and persons in need of international protection should be considered as persons traveling for essential reasons and must be able to continue to access the EU territory. Let's say in that sense, the EU's response to the COVID pandemic in the EU policies, I would not believe has specifically targeted asylum seekers or persons in need of international protection. Now, how individual member states have implemented the EU travel ban, for example, is a whole nother question. And there, I would say in our study, we've seen that certain member states have, let me not put an adjective here, just certain member states have left out asylum seekers and seekers of international protection as categories of persons traveling for essential reason when crossing the external borders. Now, whether this affects the common European asylum system, I'm not 100% sure that I'm in the right position to answer that question. But let's say I do believe that let's say the EU, at least from my impression, has consistently has remained consistent in noting that asylum seekers should not be disproportionately affected by these COVID measures, while let's say the member states have been a bit more varied in this. Thank you.
Thank you very much. Another question, has COVID affected how the EU externalizes its border control policies, for instance, its visa policy?
Give me a second. Has COVID affected how the EU externalizes its border control policies? I'm not particularly sure what is meant by this question, in the sense that, let's say, from the perspective of the EU and the Schengen area, the border control and visa has more or less consistently been seen within the context of the Schengen external borders. So particularly the case with the Schengen borders, I'd say the management of the EU external borders, the issuance of visas, etc. Now, whether COVID has affected how the EU manages its external borders, that question I would say depends. I am not 100% sure whether the issue of the visa policy has been affected, but I would say, let's say the external border management issue, you could say has been affected with the EU adopting an EU travel ban, let's say a ban for entry for non-essential reasons of persons traveling from outside of the EU and the Schengen area. So in that sense, I would say yes, but I don't know if COVID has had broader implications for the EU's border management than that. Thank you.
Okay, thank you very much. The next question relates to, is asking you to comment on the legality of quarantine policies. Is there any reference to that practice in the Schengen Code or the regulations governing Schengen?
Let's say the Schengen Borders Code, which is, let's say, the regulations which govern the Schengen area, generally only address the issue of whether the issues at the borders, so either at the external border or at the internal border. So let's say the Schengen Borders Code does not really foresee or govern the issue of what happens after someone enters the borders. And in that sense, let's say you would say that, I would say that at least that quarantine policies are more issues that would take place within the national territory that apply after a person has already crossed the border. So in that sense, it's less about Schengen. On the question of more broadly about the legality of quarantining, I would say, personally, I would say that this again depends on, let's say again, because I guess this is more from my perspective as an EU lawyer and an EU policy analyst, that it would have to depend on the specific quarantine policy and whether it meets the principles of particularly the principles of proportionality. So whether it is in proportion, let's say the measure itself is in proportion to the aim that it purports to achieve. So I don't think I would have a clear-cut answer, yes or no, to the question of the legality of quarantine policies in itself. And I do not believe that there has been an answer yet on that question at the EU level. I do believe, but I'm not 100% sure there, that, let's say, the courts in certain member states have been asked to address the question of quarantining policies. The examples that I know of are more the neighboring countries, the Netherlands and Belgium, and particularly also because I'm more because I can, let's say, speak and read Dutch. But there, the questions have been more about the legal basis. So the fact that these measures have been introduced with emergency laws, emergency decrees, rather than having a proper legal basis that went through the parliamentary, the legislative process. So whether the courts have been called to address that question, but whether outside of that, the application of quarantine in itself is legal, I'm not aware of whether that discussion has been raised, at least at the courts and particularly at the EU level. Thank you.
Thank you, Ray. One other question relates to the issue which is being discussed now of vaccine passports. How successfully do you think the European Union would handle vaccine passports for travel? And what would be the main issues and challenges that they would encounter in trying to implement that kind of system?
Thank you. Now, on the issue of the vaccine passport, and I don't think I prefer to use the word vaccine passport. I do believe that there's a very specific term that the EU has for it. Yeah, the digital green certificate, I do believe it's called. Let's say, I guess that the application of such a policy of, let's say, the introducing this digital green certificate as a way to lead to more free movement, internal mobility, particularly within the EU, but I'm not sure whether it would also apply outside of the EU, but I do believe that the concept is more addressed towards free movement within the European Union, within the Schengen area. I'm not sure that the success of this particular policy is in the hands of the EU itself. And this is my personal opinion, I think it depends on the rate at which individual member states themselves manage to vaccinate their population. Also, to a certain extent, the willingness of member states to also accept this kind of digital green certificate, the testing capacity of member states. But I believe that there might be more challenges of a more fundamental nature to this digital green certificate, and I don't think I have a, let's say, an answer at this point to that question, but I can pose the question, which is whether fundamentally the EU can or should exclude certain parts of its population, particularly the ones who would not be in the possession of such a digital green passport, from key fundamental rights, or from participation in certain parts of society more generally. So I think that will be a particular question, and it will depend on particularly how this digital green passport is implemented. But I'm not sure I have, let's say, sufficient knowledge of the matter to really assess whether this will be a success or not. Thank you.
Thank you. And this may not be your area completely, but I'm a bit curious about the way in which Brexit may have complicated management of the pandemic, and in particular some of the tensions over vaccine supplies and some of the suggestions from the Commission that they might restrict exports to countries such as the United Kingdom. Do you have any thoughts on that? I mean, that's been very high profile here too, in terms of whether Canada gets included in a vaccine export restriction, so forth.
Yeah. Thank you. Let's say I have not looked into this issue from, let's say, my perspective as a researcher. And I'm not really quite knowledgeable enough in this area that I would say is more of an issue of EU external relations and how it deals with its foreign partners. From what I understood, this, but I cannot confirm this, but this is from what I've understood, is that this has this this idea of, or this movement towards restricting export of certain vaccines to outside of the EU seems primarily to be more of a response towards the whole saga around the AstraZeneca Oxford University vaccine, and how AstraZeneca itself has dealt with its contractual obligation to deliver vaccines, on the one hand to the UK as a, let's say, as a contractual partner, but also to the EU. But let's say a more informed opinion on this topic, I don't think I would be able to provide, but I will quickly check whether one of our other researchers in the area of which deal more with foreign policy areas may have done something about this, but for now I give the floor back to you.
Okay, thanks. And just to generally draw attention to the members of the audience and people who may be listening in, that the center itself has a wide range of interesting expertise. So I definitely would urge and encourage people to check out the center's website for various publications across not only this issue, but a wide range of issues related to European Union politics and policy. But I don't see any additional questions at the moment. So I think that will bring us to the end of the question period. And I do want to thank you very much for your presentation. I think you did an excellent job of, again, bringing very complicated legal and technical issues into the reach, I guess, of informed but more public policy oriented and political oriented individuals. And I do want to thank you again for your excellent presentation, for taking the time to be with us. I want to let you know, of course, that the presentation will eventually be recorded, posted and placed on our website for any individuals who you want to recommend it to. And we'll still be, of course, seeking individuals, promoting it to individuals and other organizations as well. So thank you very much. And I think that concludes our event. And again, I hope things stay well and safe for you there. In Europe, my son is in Germany, and we're still nervous about various implications of that, but we're hoping for the best on the vaccine front, etc., in the near future. Thank you very much.
Thank you.